Yeah, that's the question, how long to treat. Sort of reminds you of Herceptin back in 2005 when we first saw it in the adjuvant setting with, by the way, hazard ratios which were not as impressive as this. Why was 3 years chosen? Because 2 years was used with some of the other therapies, erlotinib, in the RADIANT study, and that study was negative. Granted, erlotinib is not quite as potent a drug as osimertinib, doesn't have CNS brain penetration, but in any event, 2 years were done in that trial. So, based on a number of factors, we thought 3 years would be a better duration and also possible with this drug because it is so well tolerated. Only 11% of patients had to discontinue because of the osimertinib. So, could we get away with less? Perhaps. Might we need more? Maybe. Might patients come off and then have to be retreated again? These are all questions that can only be answered as the trial continues to mature. We can follow these patients at different endpoints and see. We have landmarks built in at 2, 3, 4, 5 years to look at this. We also have ctDNA, so we're getting DNA from the blood that's being collected. I think we have 11 or 12 time points of DNA, so we can start to look at if and when patients become resistant. Because that is the big question. I would agree. Are we killing tumor and curing? I think we're doing that perhaps. But are we delaying growth, and do we have to continue therapy for longer periods of time? Probably a little bit of a combination of both. And what the optimal duration is, we'll take a little bit more study. We can analyze a lot of that from this trial. And perhaps in the future, there'll be other trials that look at length of treatment. But right now, this trial was planned for 3 years. I will point out that this is an early analysis of this trial because it wasn't meant to be analyzed for a couple of years. But the safety committee, looking at safety, not efficacy, noticed signs of early efficacy. So they asked for the data to unblind this trial so we would have it right now. So we're still at only about 30% maturity on these data. All patients have completed 1 year of therapy. 66% of patients completed 2 years, and only about 35% have completed 3 years. So we still have a ways to go to get through the entire study. And we are, of course, continuing to follow the trial for overall survival, as is always the case. But at least the early results, as a practicing oncologist myself, I was expecting this drug to work, but not to this extent. You would have thought, a hazard ratio of 0.7, 0.6. It was actually statistically powered for 0.7. And I would have been happy with 0.6, 0.5, 0.4. But, this result just caught us all, very pleasantly by surprise that this drug is so effective and so well tolerated.